Hi, Molly. Thank you for joining me today on the podcast. And if you see it on YouTube, I just came from a run, so I'm in my running gear. I didn't get a chance to shower and change.
No judgment here.
I have 4 children and I work. No, okay. So anyway, I wanted to really talk about what you do, because one of the questions I get a lot in my office is, what is a doula? And are they worth having them? I get that a lot. Like, some people have heard of them, but they're like, I don't know if I want to spend the money on it, or my husband's not too sure about it. I get that a lot. Yeah. And I swear by doulas. So my dream team, I had 4 home births. Everything went beautiful. You know, I had great prenatal care, great postnatal care. And my dream team was my midwife, my doula, my chiropractor, my acupuncturist, and massage therapist.
Wonderful.
So that's my dream team. So that's what I want everybody to have for their births. And then obviously if they need more intensive care, then they go on to their OBGYN or their medical providers for that. But if you have an uncomplicated pregnancy and everything's going great, that is my dream team. So I want to talk about what a doula is, what you bring to births, to laboring families, not just moms, but dads and everybody else in the room. And also want to talk about labor doulas as well as postpartum doulas and what they do. So thank you for joining me. If you want to say hi to everybody, that'd be great.
Hey, everybody. As I'm sure you heard, I'm Molly. And so, I mean, we get those questions a lot too. Even people coming to us that have a general idea of what a doula is. You know, a lot of times they're just like, oh, well, my friends told me that I need one, so I'm calling you, right? So how I explain what we do when I talk to families is that regardless of whether it's a labor doula or a postpartum doula, our goal is to care and support for the whole family. And to help them be not in a place where they're just, you know, in survival mode, but really trying to help them thrive. So in a labor doula situation, our goal and how we support families in that way is through our time with them in pregnancy, throughout the labor, and also throughout the postpartum as well. So in labor, our job is to help them gather all the resources and, like you're saying, make their dream team that they need. Figuring out, like, regardless of what their birth story is, you know, they're planning for it to look like, or how it may play out, figuring out at the end of the day what is most important to them and laying out a good foundation to give it the best chance possible. But also kind of working through those contingencies. Okay, if plan A is not able to happen or there's some type of complication, what is plan B going to look like? And what are some things that you can do in the moment to prepare for that situation and, you know, help yourself feel more confident in the chaos? And as well, you know, being kind of that ear for them to talk through their appointments with, or, you know, a lot of times, you know, we'll have families come to us and say, you know, I read this blog about this intervention, or my doctor talked about that, and I've heard all these scary things. We try really hard to have really good, solid, fact-based resources with them with current research. So we're really kind of the safe search on Google for them, helping them, you know, feel more confident in their decision making throughout the process. And then whenever baby is ready to arrive, whether that's happening naturally or an induction or a scheduled C-section, we're there with them throughout the process. Generally, people are calling us in when things are like really getting ramped up and they're feeling like okay, we've had our time, just us, and we need an extra set of hands. And we stay with them until the baby is born. And then also follow up with them postpartum, making sure they have those resources, and they're feeling like they're having a good foundation going into their postpartum recovery.
Yeah, I mean, I can imagine having my labors without my doula, and my husband is such a huge fan of doulas. He tells all the husbands that they need to get a doula. So, so people who say, like, I can answer or get all my questions answered through my midwife, and I feel like she's going to support me enough. And my husband is great and kind. I think he's going to be a great support. Like, do I really need a doula? So what does a doula bring that is that extra something for those people that really can make the difference?
Yeah, well, each of us on the birth team, and we all have our specific roles and bring our strengths to it. I mean, every midwife, kind of our OB, has kind of their different style of, the time that they're spending with you actually in labor, right? Midwives are more accessible to you to have that hands-on support, but a lot of babies like to come in the middle of the night, and if you want your midwife or whoever your provider is to be alert and awake for you, so they're spending time having their own self-care, sleeping, and checking in with you as needed. But a lot of the time, regardless of where you're having your baby, it's kind of just you and your partner just working through those contractions. And in regards to your partner's role, we come in and we spend time with you prenatally, but whoever is with you to be your primary support role, they have that emotional connection with you, and they know you deep down, and they are going to be your true kind of rock emotionally, and be able to kind of be a true gauge of where you're at, and seeing like, are you feeling confident? Are you doing good? Are you kind of crossing that threshold of, okay, this hurts, to, all right, I can't do this, right? And so not only are we, supporting them with information, but we're caring for the whole team. So making sure that dad is able to be a sustainable support, or dad, or, whoever the other parent is, or if it's mom or a friend, right? Whoever it is, making sure that they're fed, watered, right?
Yeah.
And that they have information, so they're feeling confident in the process. So that way they can be the primary support for their partner. We do a lot of the hands-on stuff that we're famous for, right? Helping with positioning, doing those touch techniques to help, cope with the labor pain, giving more relaxation techniques, and helping them focus. But each of us kind of bring our own flavor into the room, and our goal is to read the room and seeing which piece is needing support, and being able to provide that to them, keeping in mind what's happening with the labor and giving them the most appropriate tools.
Oh, and I think I've heard a lot of comments come back from families, and especially from partners who have, maybe this is their first birth, or it might even be their second, but it's completely a different birth. I mean, every birth is different.
Oh,
and and it is having the doula there to say, this is normal, this is okay, she's doing great,
right.
meant the world to them. I had one father who came to me and said, she started making noises I have never heard her make before, which happens. In labor. It happens a lot, because we get into our true essence of birth in these times.
Very raw.
Yeah, and he's like, I would have freaked right out. I would have called everybody, called the ambulance. But the doula came over, just put her hand on my shoulder and said, she is doing awesome. This is great. This is beautiful sounds, like those things. And he's like, the weight, because he felt that if he hadn't had that doula there, all the responsibility fell on his shoulders, and he was, he was going to have to, he's protecting his wife. And when he hears things he's not familiar with, he gets scared. So like you said, it helps the whole team. Right. And yes, there are people that can help with that, but the doula during that birth was essential in that birth process, and just bringing it all back down to a calm, beautiful birth, which it was. So he came in, and he was just like, he was one of those unsure, do I need this? And he came in and was like, thank you so much for making me get a doula. Yeah,
totally. Yeah, some of our more skeptical dads end up being our best referrers, because they're the ones that are whispering, like, is her body supposed to be doing that? Like, is this something we should call a nurse about? Like, is she okay? And, just giving them the reassurance, and, giving them kind of the permission and space to get what they're feeling out, without them trying to, worry the lady that's trying to focus on having a baby, right? They don't want to share that with her, because they're worried that, that will make her feel a certain way. And so, the partners, I haven't, left a birth and had a partner that wasn't like, wow, like we needed you a lot more than we thought we did, right? And every partner comes in to the birth space with different expectations, and a different comfort level. Some of the partners are like, I want to be hands-on. I want to catch the baby if I can, be there for every contraction. And other partners, whether they've had some type of, trauma in the past regarding hospitals or medical events, that they're just not comfortable with the process and they're carrying a lot of apprehension, we're able to give them space and permission to, like, if you just need to go walk, go outside and walk the hall, get a breath of fresh air, helping them be in a proper space so they can be the best support. Every family is so different that it's like going into it, they know that, the doula may have to be more hands-on. It allows them to really play their strength and not feel like they have to do it all every contraction.
Yeah, and I think a lot of people don't understand that it's great to hire a doula early on in pregnancy because you get to meet with the doula a few times before you go into your labor. Mm-hmm. And so when is the best time for someone for a couple or a mom, if she's alone, mm-hmm. to hire a doula in the pregnancy process?
Yeah. We've been hired at 6 weeks and we've been hired at 38 weeks, right? So there's never really a too late time to hire a doula, but generally, the earlier on that you're in touch with us, the more that you're going to get out of our service, right? The earlier on you're going to be able to, make sure that your provider is the right fit and have us kind of talk through your different options in the area. As throughout their care, getting them more resources, helping them understand kind of what's happening throughout every step of the way. Also, kind of the practical things of as they're gathering their supplies, knowing what is appropriate to bring wherever they're having their baby, what do they need to prepare for postpartum. We try to have some aspect in that regardless of when people are hiring us, but the earlier on that people are having us join their team, the more that they get out of our service.
Yeah. When you think about birth too, it's an intimate process.
Yeah.
It's like you want someone to know you and know what your preferences are, and you want to be comfortable with someone. So I encourage people earlier on. I hope by at least 20 weeks they've hired somebody. Mm-hmm. So that they have at least the last part of their pregnancy to get to know them, to feel comfortable with them, to let them into their lives, because the more you know as a doula, the more you can help them, but also the more they know you as a doula, the more at ease they are.
Exactly.
And I know you're very well aware that if a mom is in a state of fear, mm-hmm. if she's uncomfortable with her surroundings, it's not conducive to a nice, smooth labor.
Those sometimes are real.
it can shut things down. That's why a lot of times moms will go into labor, and if they do transfer to the hospital, they transfer to the hospital and it just stops because it's a new environment. There's new people. There's different stuff going on. As much like, the deer and the headlights, like all of a sudden when you shine the headlights on the deer, they're not going to have a baby right then. So, that's kind of drastic and dramatic of a change, but the more comfortable you are with the people in your environment and the more you trust them.
It's true.
The easier it is for you to have a nice, smooth, beautiful labor. So you want to really be comfortable with those people.
For sure. And even if things don't go perfectly according to plan, having that person that you're going to have a million people rushing in the room, right? And so having that team around you that knows you, knows kind of the reassurances that are going to make you kind of be as grounded as possible in the situation is really helpful for both the woman and her partner.
Yeah, I look at it more like you're bringing in a friend into your labor who really knows you versus like a stranger who has a lot of great information and skills and knowledge and can really help a ton still. Mm-hmm. But it's that extra level of like knowledge and comfort between the two of you.
For sure.
Three of you. I had 2 doulas at one of my labors, so and that's how much I love them.
Yeah, we try to warn people we're most likely going to see you naked, so let's just kind of let's work through getting to know each other first, right?
Yeah, let's have a little bit of acquaintance here before.
Yeah,
right. So we've mostly been talking about labor doulas. Mm-hmm. I know that there are other types of doulas. the two that I really work with the most are labor doulas and postpartum doulas. So what's the difference between a labor doula? Because I know you said that they will come in and check on you postpartum, but what is the difference between that and like a true postpartum doula?
Yeah, that's a great question. I mean, the capacity that we are giving postpartum support in at the end of your pregnancy, or, you know, after our postpartum check-in is what I'm trying to say, is more of just checking in with you and setting you up with the right resources. A fully trained postpartum doula, our goal is to care for the entire household. So what that looks like practically is whether it's day or night, we're providing things like infant care, light housekeeping, pet care, you know, as well as like setting you up with some good resources if you need it. But really kind of finding the places in your household that you are feeling like are, you know, out of control or not being attended to, and helping get that back to a level where you're feeling comfortable and like you're in your new normal. Daytime, that's a lot more of like you know, maybe we'll watch baby so you can like take a shower or, you know, take a nap, or, you know, we're doing like housekeeping and helping you organize and, you know, all those sort of practical things. Night shifts are purely focused on you getting a full-ish night's sleep, right? So in that case, you know, we'll come to them in the evening, depending on when our shift is starting. You know, we're helping them with dinner and that whole bedtime routine. And then once they go to bed, you know, we're with baby in the nursery or wherever is practical for us to be staying with baby. Every time baby wakes up, depending if they're wanting to breastfeed or bottle feed or feed a bottle of pump milk, you know, we're getting baby changed, you know, bringing them to mother or giving them that bottle. And then as soon as the feeding is done, soothing them, putting them back to bed. So that way mom can just, you know, either sleep through the feeding or just only be awake for the nursing session and go right back to bed, not even have to leave her bed. And then while baby's sleeping, you know, we'll try and quietly attend to the house as well as much as we can, without disturbing too many people. But really, you know, allowing them to wake up feeling refreshed, and that, you know, they have a good start for their week or their day.
No, it sounds so dreamy, and it's things that people should have. You just had a baby. Like, if you don't have family support or someone who's doing that for you, I mean, I didn't have a postpartum doula per se. My mom came in and helped for a couple weeks. My last baby, I had basically she was a postpartum doula, but she was a young, early 20s woman that we've known. She knows our family. She moved into our house for 3 months. And oh my goodness, you'd think with 4 kids, that'd be crazy. It was the most glorious fourth child in the world because you have the support. And so I think it's worth its weight in gold. Like, it helps with nursing. Okay, I'm gonna have you talk about all the benefits of having a doula for birth and then also for postpartum, like the health outcomes. Like, what kind of things do we see with people who have doulas as a support?
Yeah. So, I mean, we find that after, you know, or when we're working with our clients, I mean, they're able to get more sleep or take a nice restful nap throughout the day. You know, they feel like their house is not chaos, right? They wake up from their nap to a clean house with the dishes put away. You know, if they're wanting us to do meal prep, we have those things ready for them. So they're not having to, you know, rock a baby while they're cooking, right? You know, they feel like they have more time to spend with their partners as well. I mean, it's kind of goes without saying that having a baby is going to affect your relationships. And just the time it takes changing diapers and nursing is so much time out of the day that if we can take care of all the rest, they're able to have more time to just spend with their partner and reconnect. Even if it's as simple as like, wow, like we're sitting at the table together. Like, you know, something as simple as that can really, you know, make all the difference, and that mental health state postpartum.
Yeah, and just the rush of like oxytocin, because if you look at it as a physiological way. You know, if you have stress, which all these things that you have to feel like you have to do as a new mom, have to cook, have to clean, have to take care of the baby, maybe the baby's fussy, you're not getting enough sleep, you're in such a high amount of stress, cortisol levels just spike.
Yeah.
It can affect your breastfeeding. It can affect your letdown. It can affect like so many things health-wise that are not conducive to supporting that baby. We really need to wrap our arms around moms and new babies. And that's what I feel doulas do, and especially in that postpartum time, but also during labor. And so many moms, I think, young moms I have that come into the office who are on antidepressants already and anti-anxiety medications. And yes, this might not cure all of that, but I think if we can come together as a society and have, you know, services like this for moms, it's going to diminish it. I strongly believe that community support diminishes that and then improves health outcomes long term.
Well, so,
So talk about the health outcomes and benefits of having a labor doula, because we mostly talked about postpartum there, but for labor doulas, like what are some of the things that we see with people who have doulas?
Well, I mean, there is research out there that talks about, you know, having that continual support throughout labor. It has improved health outcomes, whether that be, you know, less risk of C-section or, you know, less Pitocin needed or, you know, less requests for epidurals. And I mean, all of those are very notable, but birth being as it is, you will have those families that do all the right things and birth doesn't go according to plan. So what we really like to spend time focusing on with our clients is, you know, we can't guarantee any outcome. Yes, there is, you know, health benefits to having a doula, but when it comes down to it, we really like to focus on kind of the psychological benefits of going into this, you know, huge raw process, feeling like you're prepared, feeling like you have a team behind you that respects you and is going to help facilitate, you know, conversation throughout whatever is happening in the labor. And even if, you know, things are interventions or a C-section or something is needed, that they have an awareness of what's happening around them. It's not just happening to them, right? And so, I mean, we like I said, we can't guarantee it, but our goal is at the end of the day for our clients to feel like, even if it went perfect or nothing went according to plan, that they were part of the process. I think a lot of families that go through a traumatic birth leave there just being like, I didn't even know what was happening to me. You know, it happened to me, I wasn't a part of it. And so being able to walk with them through every step of the way, whether it's a positive or a negative experience, knowing that they owned every single decision they made, that they made the best decision possible for their family, and that they were a part of every decision and every conversation.
Yeah, I've seen dramatic differences between women who have felt like they didn't know if they made the right choice and kind of like were pushed along to have a C-section versus women who've had a C-section still, same outcome in birth. I mean, everything was basically the same, but they got to process it and they got to make the decisions and they got to like see like the why, and they got to like, and there's things you can do during a C-section that can also make things a little different and a little bit more bonding for the mom and baby and things like that too. So
and we're very like blessed to be in an area where generally our providers are really respectful of women's decisions, especially at the hospital. I've been really impressed with, you know, they try all the things before going to a medical, you know, switching on to the medical side of it. And I mean, our hospitals nowadays, I mean, I had, to give you some perspective, my first, he's going to be 8 here next month. I had him at the hospital, and I had my recent baby, who is 14 months old, at the hospital as well. I had a birth center birth in between. But one from 8 years or 7 years to another, it was a totally different hospital. Like I went into becoming a doula being like, oh my goodness, I'm going to have to go with my flaming sword and fight for these women. And the hospital has just really made a huge effort to, you know, be respectful to families and to give them kind of that conversation as well. And so I think it's helpful for them to they're gonna, more often than not, they're gonna get good care than they compared to some other care that is available in either different areas of the state or different areas of the country. But just having that knowledge of like, okay, like I knew these things that were happening to me. I knew what they were ahead of time. If it was unfamiliar, we kind of talked through what was happening. We talked through if there was any alternatives, and just being a part of it kind of, not that it is for everybody, but they feel like it makes it less scary, right? It's just makes it part of the process and not, not this, huge trauma, which it still can be regardless. I mean, you can have a perfect natural home birth and still view it as traumatic. But, having that emotional support and that knowledge every step of the way is just key.
Yeah, and that is huge. That was my husband, if you were watching on YouTube. Came in and like popped out. Like, I don't know if you ever saw that video of the guy who was like live on some show and his kids came in, the nanny got him and
he's crawling underneath.
Yeah, at least he can like walk himself back out. So is there anything else you want to share? I think we kind of covered most of the questions I had for you. What kind of questions do you guys get for doulas that I haven't asked you? Is there anything else that pops up?
Well, we touched on it a little bit, but a big question that we get from the partners especially, or even from the women who are, wanting their partners to be a big part of it is, hey, if I have this doula, are they going to replace my partner? Is my partner going to feel like he or she is just, in the corner, just watching something happening, and this doula is just coming in and doing all the things and the star of the show? Our goal, like I said earlier, is to make the partner really be the primary support person. And so that looks different for every partner, given their comfort level and kind of what their goals are and their expectations are for support. But we never want to replace a partner. We're having that be a conversation with them, gauging their comfort level, giving them tools, and if they're not comfortable, giving them permission to kind of take a step back until they're ready to give support in another area.
Yeah, I have found that. I think my husband was happy to have like the women take over. He's like, I'm just good with all the women being in there. I'll come when you need me. But some couples and some partners really want to be like a big part of it. And like my husband was a big part of it. And I'm sorry, honey, I'm not throwing you under the bus, but but yeah, so that everyone's going to have a different,
and that's
different
totally
dynamic.
Okay. Yeah.
Cool.
I should say the other question I get is, well, if I took a childbirth class, do I need a doula? Or if I have a doula, do I need a childbirth class? And that's another thing, that having that variety of background for your knowledge is going to be really beneficial. We tell everybody, even if you have a doula, take a childbirth class. Like we talked about, like knowing what is happening in your birth. We've talked with couples that have, had that situation where nothing went according to plan, but they're like, hey, we knew what was happening when they suggested this intervention. We knew what it was. It wasn't scary. Yeah, this recovery is different and it's unfortunate, but it wasn't a traumatic experience, right? And on the flip side, like, do you need a childbirth class if you have a doula? Our job, we're going to be there kind of real time, giving you information, giving you tools. But if you're doing these things for the first time in a very emotional kind of high stress situation, it's not going to generally go as smooth as you would hope it would. So being able to have the background of what's happening and have it be more of a reminder and a refresher as we walk through the entire labor, rather than like, okay, I'm trying all these things and hearing about all these things for the first time. It's really benefits family to have that whole comprehensive preparation before labor, and that comprehensive and continual care throughout your labor as well.
Yeah, I'm a big proponent of like knowledge is power. It's a big reason I'm doing these podcasts, is to give people information so they can make their own empowered decisions. And then they don't think they feel as victimized. Or feel more powerful, feel more in control, and can make positive changes in their health and wellness and yeah, and just be in control of their choices. So yeah, I think it's cool. I hope everybody who's pregnant has a doula, and has the support that they need, has their dream team in alignment. If you aren't happy with your providers, get somebody else. That's all I have to say. Like, you have to be comfortable with the people who are around you and who are supporting you in pregnancy and labor and delivery, because it can be a wonderful and beautiful and amazing experience. If it doesn't go as planned, it still can be wonderful and amazing and beautiful. Nothing goes 100% as planned.
Yeah, right.
Even, it just doesn't. Even my labors, looking back on them, were wonderful, but they weren't exactly as I had planned to do them. Like, just you have to shift and adjust. So anyway, anything else you want to share? How can people get in touch with you guys? You guys are local-ish to me. You're not too far away, like 30 minutes from me. So that's pretty local. And you do come down to our valley with your doula services. So, but how can people get in touch with you and the people who are listening in other areas? How is a good way to find a doula for them?
Yeah, so at Doulas of Bellingham, we serve Whatcom and Skagit counties. We can travel farther than that with special accommodations for that. And if one of our clients needs to, transfer hospitals, say down to Everett, or for more specialized care, then we are able to, attend their labor down there as well. In order to get a hold of us, you can visit us at our website, which is www.doulasofbellingham.com. We have our number on there that you can call us, or you can email us at info@doulasofbellingham.com. And I should say, something that makes our doulas a little different than the typical doula structure is, well, there's two things. The first one is that we work in teams. Each couple gets two doulas. One of them attends the birth, but both of us are spending those prenatal time with you, getting to know you. And then we have our own kind of on-call schedule. But that way, sometimes two babies like to come on the same day, or one of us gets sick. We really feel like this is a solid coverage for our families, so that they're still getting a doula that they know and they trust, even if one of them isn't available. And the second part of what makes us different, which thankfully in the doula world, this is less different now, but our main goal is unbiased support. I feel like pregnancy and birth is such a polarizing topic, right? And within that, every topic, you're gonna hear, complete different, views on it. And people are, because it's such an intimate process and it's their baby, there's very strong views on either side. And so we do our best to just be that person in a family's life that they can just come to and saying, like, here's what we want, here's what's important to us, and being able to provide that support without being like, well, here, you should try this, or, oh, well, did you hear about this happened and that happened? Like, we want them to, we trust that our families are coming to us knowing what's important to them, and that they're smart people, and if they're making decisions for their families, that we can trust their judgment and allow them to do what's right. I mean, you never know somebody's story and their background, and so even if we're the only people that they come in contact with them, that's not teasing them about their baby name, or respecting their decision to have a planned C-section or induction. We really want to be that foundation for families where they have that confidence saying, hey, this is us and we need to do us.
Yeah, and that's awesome. I always tell parents that all the families that I see, they make different choices. I have people who make different choices on different things in their life and their health. And I can tell you one thing about all the parents that I take care of and all their kids I take care of, is they all love their children so much, unconditionally, and they are making the choices that are right for them with the information that they have and with their experiences, and who knows, like, everything that comes with them in their past. We don't know their story.
Yeah.
So I always support families' choices. I want them to make educated choices and then support them in their choices. So I'm so happy that you guys are doing that, because I know sometimes sometimes we make different choices than our patients or clients will make. And it's, and to be able to, put that aside and say, this is who they are, and I support you 100% in your choices. So
for sure.
Yeah, that's why I love working with you guys, you and Christy, and sending people to you, and because you're solid, you're there, and I just love working with you guys. So
thank you. We enjoy getting to know you too over the last few months.
Well, thank you so much for joining me. I will definitely make sure when I post this on my website, which is fearlessfamilyhealth.com, and on Facebook and everywhere it's going to go, that I will have contacts so people can reach you guys.
Yeah.
And then if someone isn't local, like they're in Louisiana or Florida, is there a place to like just kind of go and look for a doula?
Well, I mean, most commonly, a lot of people are just finding us through Google, right? And if we have families who have moved, or some of our friends and families, I mean, that's the first place that we go to, is kind of, going through those initial, that initial Google search, right? And seeing kind of who is working best with your family. A doula specific search for also birth and postpartum is doulamatch.net. I believe it's .net.
I think it's .net.
Yeah, and so that's another resource for families to go. And you can kind of just type in your zip code, and whether you're looking for postpartum doula or labor doula, see who's available to you in that area. So between the two of them, you can usually find kind of a good pool to see who's best for your family.
Yeah, and then when you said find a good pool, we didn't really talk about this, but I wanted to mention it real quick, that you can get like 4 or 5 or 6 doulas in your area, and you can look at their resumes or call them and see who, what they've done, and then interview them and meet them.
Yeah.
And see who fits right and feels right, and trust your instincts and trust your feeling with that person. So, And how many doulas do you guys have right now?
So Christy and I are the owners, and we have, oh my goodness, I think 6 or 7. I'm terrible. I should know this. Affiliate doulas working with us, as well as a birth photographer, who's kind of our in-house resource for families.
Cool. So thank you very much for joining me and sharing with doulas. I obviously am a big fan, if you haven't noticed already. And I hope everybody gets out there and learns more about doulas and gets one for their labors. Thank you, Molly.
Yes, thank you.